Assalamu alaikum, good morning. My name is Dr. Mehar Ali. I'm a senior consultant interventional cardiologist at the Aster Al Hospital Al Gubra. I just want to spread to the community that one has to take care of all the risk factors for heart disease. Nowadays we get a lot of heart problems even in healthy young individuals without any known risk factors. So having said that, if you are diabetic, if you are hypertensive, if you have high cholesterol in the blood, there is no point in watching and delaying the treatment. Nowadays the recommendation is to start medications from an early stage so that you prevent the after effects in the future. Of course, cessation of smoking, I don't have to say, that's a very important thing to do. And eat healthy and exercise and have a good lifestyle. Diabetes and hyperlipidemia you can at least detect on the blood test, and then you can convince the people that your cholesterol is high, your bad cholesterol is high, and your sugars are not controlled. So you have a valid point there to justify treatment and to take medications regularly from the people's side. One of the most ignored things, as far as I am concerned, when I see many patients in the private hospital, is hypertension, which is being ignored. And people know that their blood pressure tends to be on the higher side, and they've been watching for years and years, and they're not doing anything about it except watching. So please start treatment for hypertension from the early stage. How much you exercise, how much you control your diet, the factor in reducing the blood pressure may be minimal, and you often need medications to support. Losing weight is a very important thing and very useful thing for people with hypertension. Don't worry about medications for hypertension. Medications are not going to cause any permanent damage. So the motto for the World Heart Day is for the people to be aware of the risk factors and take medications from a very early stage so that you prevent the problems in the future. Then one has to be aware of the symptoms of heart problems, and sometimes you get pain in the chest, pain in the epigastrium, and people sometimes ignore it as acidity and gas. But be aware and come forward and to check your heart, at least by an ECG and a blood test, so that you don't miss a heart attack. The heart attack, when it happens, the important thing is to get to a hospital where facility for an angiogram and angioplasty is available, because time is muscle. Heart attack is not just block, but block causes damage to the heart muscle. So you want to prevent that muscle damage or minimize the damage by early presentation to the hospital and get the appropriate treatment. Thank you very much.